Parents will do anything to protect their children. But when they can be made safe from measles, there are parents who deliberately withhold vaccines. In 2000, thanks to vaccines, measles in the U.S. was virtually eradicated. This year, more than 100 million cases were confirmed in 8 states, one being Colorado.
Over the last few years, we've had a pertussis epidemic in Colorado, a lot of cases of whooping cough, and that hasn't really scared people into getting their kids vaccinated. However, the measles outbreak right now is getting a lot more attention.
The CDC recommends 2 doses of the vaccine, between 12 and 15 months old and between 4 and 5 years.
The measles outbreak doesn't concern me specifically so much as it does for my concern of other mothers that have a child that's under a year old.
There are many reasons not to get your kid vaccinated, many for religious or medical purposes. But just keep in mind, if your kid gets infected and he walks out these doors, he may be putting the rest of the community at risk. Here at CU, chemist and Professor Bob Sievers spent 10 years developing a powdered version of the measles vaccine. While there are parents who worry about safety of vaccines, Dr. Sievers says they need to educate themselves.
Study the issue, consider your child's safety, whether it would be more hazardous for them to have the shot or inhale the powder than it would be if they didn't. And consider also the effect this has on their classmates and on the other people in the community.
According to numerous studies, vaccines are shown to be safe and effective, although perhaps no amount of evidence will ever convince somebody who has already made up their mind.
I would hate for it to be something scary, or I would hate for a child to die to get people's attention.
But occasionally, children don't respond to certain vaccines or they can't take them due to allergies. All the more reason why they have to depend on the immunity of others for their protection. Alec Moreland, News Team Boulder.